With me today is the lovely Dr. Aishwarya Navale, renowned dentist and owner of the Crown Aesthetic. Doc, let's take you back in time to this beautiful city called Pune,
Pune, truly, it's the Oxford of East.
right?
So when you said Pune, obviously it's the major educational hub.
It is.
Yeah, all the great universities are from Pune, and I come from a medical background, so
Okay.
I was always interested in this field. Along with medical, I have a small interest in artistry. So I thought, why not I choose dentistry?
So medicine and art.
Yeah, it's a combination of medicine, art,
No,
and aesthetics.
So medicine and artistry is dentistry.
Yes.
Fantastic.
True.
Okay. So then what drew you to dentistry?
So dentistry, it's like an art, and
Right.
I'm kind of interested in both medical science and arts.
Right.
So I love designing smiles for the people,
Right.
and also I'm more keen in the cosmetics also. So I do cosmetic dentistry, that's smile designing,
Right.
and my main field is implants and periodontology. So it comes more under surgical.
Right. Right. You know, curiously, you mentioned about dentistry and art. And I remember I was asked once, what or how do you define art? And I just said, well, everything that stems from the heart is art.
That's true.
So this goes with exactly what you said. So then, obviously, I guess the next question is dentistry and smile makeovers or your smile enhancement. How did you align that?
So dentistry, obviously, that like I mentioned, it is an art.
Right.
Yeah. So accordingly, since the beginning, I'm very interested in designing smile.
Right.
And also along with that, we consider the facial aesthetics of the patient. So accordingly, we design it.
Right.
Dentistry is a vast field.
Right.
There are 8 type of specialties in dentistry.
Correct.
Including root canals to surgical dentistry.
Right.
Yeah. So, smile designing is one branch of dentistry where, along with science of smile makeovers, we design the aesthetics of your teeth.
Right.
So, we create a custom made smile which enhances your natural smile appearance and creates its most beautiful version without any filter.
So, here's a quick question. With somebody as pretty as you, is it all God given or was it also enhanced?
That you can judge now.
No, but this is a compliment to you, doctor.
Thank
that
you.
I mean, I wish today more dentists especially look like you, because then that pre-pain before you visit the dentist goes away. No, but seriously, I mean, most of us, we equate going to the dentist with pain. How do you get people to manage pain?
See, the first thing is that how comfortable you make your patient feel.
Correct.
Once he's on the chair. Obviously, most of them are frightened with even the sound of the drill.
The drill, yes.
Yeah.
Yes.
So it's how we distract them.
Right.
And how we explain them the procedure initially. We have to stay very transparent with your patients. We have to explain them every step. Right. So that we can't keep them in a loop.
Correct.
So that's how we can build a connection also with the patient. Right. And at the same time, the patient feels comfortable with you.
You know, I'm sure you've encountered people morbidly fear, with morbid fear. So was there anybody on the chair, they just started squirming and, so no, doctor, please don't inject me and stuff. Yeah. So in a case like that, where it's extreme, how do you handle it?
See, there are patients, I think most of them, they're scared of a dentist only. Correct. And a dental chair.
I remember telling somebody the greatest invention would be a soundless drill.
That's
if
true.
That drill didn't emit sound, I mean, most patients would be fine.
Yeah, people are so anxious, but we ensure, that's what, like, in a good conversation, we ensure that how comfortable they are.
Right.
And there are painless techniques present now. So we inject first, we usually, people are scared even of getting pricked.
Yes. In fact, I fall in that category. For me, the actual work is fine, but I'm very apprehensive of that anesthetic that they give.
Yeah. So for that, we apply topical anesthesia.
Okay.
So that they won't feel the prick of the needle of the local anesthetic. So that's the best way we can handle it.
Correct.
And nowadays there are many AI generated devices present.
Right.
And then main thing is that how we distract the patient.
Yes. No, that's where your skill comes in. The skill level.
So the skills, it's the topmost concern, like how you handle your patient.
Okay. So broadly, what comes under smile enhancement?
Smile enhancement also is it's a vast field.
Right.
So there are many treatments which comes under smile enhancement. It depends on your patient's concern.
Okay.
Like what concern does he have?
Right.
So first, and the basic treatment, we can start from whitening.
Oh, I see. Okay, good. Good. Yes. Yes.
Polishing and whitening.
Yes.
So polishing, it includes removal of if the patient has superficial stains, visible stains, or whitening also if the patient is not comfortable with his tooth color.
Right.
Or there are yellowish teeth, grayish teeth, dull looking appearance of the teeth. So they can get it done in like around 45 to 60 minutes.
Wow.
It's a very, you can get it done in a day.
And that would be step one towards looking a little better than you already did.
Yeah. And also what I mentioned, it depends on patient's concerns.
Okay.
So if anyone they don't like the shape of their teeth, the alignment of their teeth.
Right.
Or few people, they have missing tooth or chipped off tooth, crooked tooth. So they can go for veneers or aligners.
So what is essentially the difference between crowns and veneers?
See, crowns, they cover the entire surface of your tooth.
Okay.
When placed.
Right.
Mostly we do root canals before placing a crown.
Right. Once it's done, the crown is...
Yes. And veneers, they just come on the front surface of your tooth. Same like a contact lens.
Right.
Covering the front surface where they are very thin, shell-like custom-made veneers according to your needs.
Right.
So you can replace it with whichever color you want or whichever shape you want. If people are not comfortable with their shape, like few people have smaller looking teeth, peg-shaped teeth.
Right.
So they can get a proper shaped teeth which can enhance their smile.
Right. And would the cost also vary considerably in veneers?
Yeah. So the cost depends on which all teeth is involved.
So let's say the entire front set, both upper.
So we while planning veneers, we consider how wide your smile is and how many teeth are visible in your smile.
Right.
So the cost vary according to that.
I see.
Per tooth.
Doc, I'll tell you. Being in the profession of pageantry as I am, there are numerous women who will spend lots of money on the external, meaning on clothes and on makeup. And I've told a couple of them that, when your inner beauty, so-called, radiates from within, there are two things. One is your confidence level, and obviously which gets enhanced with a smile. But very few people, concentrate on their smile. What is your advice to them?
See, I think smile is a type of a self-love.
Right.
A self-expression. And I think especially for these celebrities, influencers, models.
Professions that are always in the limelight.
Yeah, always in the limelight, facing the camera. Especially working professionals, celebrities, influencers, actors.
Right.
Smile is the main thing, I think, which showcases their self-love, self-expression.
Yes.
And also it enhances their confidence.
Your smile is the ultimate crown you can wear.
Yeah.
Yes. And it's the only constant crown. I mean, crowns sometimes when you get a crown and they are displaced. This never gets displaced. Me, I have the tendency not to showcase my teeth when I smile. And I'm sure that's a common thing with everyone because in the back of your mind, you don't have the most perfect set of teeth. So how would you get people to, I mean, obviously when you enhance your smile, you're also showcasing more of your teeth. So if you can allow people or advise people that come and get your teeth done, I'm sure that will be the first step towards a more perfect smile.
Yes.
Yeah.
Obviously, whenever a patient walks in,
right,
we always focus along with the dental checkup. I always advise them smile designing counseling is always done.
Right.
Once they walk in, I start observing their smile. Then according to that, I explain them.
Okay.
If one really is keen on getting the smile designing done, then we check their smile. How's the smile profile, left profile, right profile? How's the smile in the front? How wide is it?
Right.
Then we ask the patient for their photographs. How do they smile in normal photos?
Right.
So we compare it. Then we show it. There are
simulators. You can
digital smile designing software present nowadays. So in that we can take his photograph. We can
show him exactly
we
what
can
he
just
look like after.
simulate the smile, which can be done later after the
Fantastic.
treatment.
Fantastic.
So he can approve it right there, and we can go ahead with the further procedure.
So this automatically brings us then to cost. Roughly, because I know whenever you're talking smile designing, people will always equate it with a huge cost. So how can you just share with a layperson what the costs are?
Costing, actually, I can tell you approx.
Right.
It ranges from 8 to 15,000
Mhm.
per tooth.
8 to 15,000 per tooth. And
So
then
it
depending.
depends on how many teeth is involved. These are for veneers.
Okay, so let's say, for example, as a person, I come to you and I say, Doc, I need to showcase or I need to show more of my teeth when I smile.
Yeah.
You'll obviously talk about the front 4 or the top 8 teeth and the top lower teeth, right? So that would roughly cost about 1 lakh of rupees.
Yeah,
Or
it goes around. We can range from like 50 to
Yeah.
1 lakh.
Which is pretty nice, which is pretty affordable.
And also higher. See, it varies according to the warranty also.
Okay.
So the one which have 5 years, 10
Right,
years, they are
right.
less costly
Okay.
compared to the lifelong warranty veneers.
Right. Those obviously cost a lot more.
Yeah, yeah.
But Doc, again, if I'm talking more from the layperson's point of view, so if a person would come and sit with you, let's say today, how many sittings are involved for basic smile analysis?
See, for veneers, minimum I can say
Right.
5 days.
5 days.
5 days, 5 to 10.
So and obviously there'll be a gap between each sitting,
Yes,
right?
yes.
So you're talking about a total span of about 10 days?
Yeah, 5 to 10 days.
Correct.
The patient has to come at least minimum 3 times, 3 to 4 times.
Okay.
So
Okay.
in this first sitting, we can take a initial scan.
Right.
We can scan his teeth, we can measure his smile, we can take his photographs, and accordingly we can show him how his smile will look like I mentioned.
Right.
We can simulate and show in the software.
Correct.
Once he approves, we call him the other day for tooth preparation.
Okay.
So for veneers, we need to prepare the tooth. Like there's 0.2 to 0.2 to 0.5 mm depends on the
Right.
patient's concern. Grinding we need to do on the frontal surface of your teeth,
Right.
on which veneers will come.
Right.
Yeah. So that is done in the second appointment. So after 2 to 3 days, once the veneers are ready, it depends upon the lab also now, how
Correct.
fast they give us the veneers.
Yes.
So according to that, we call him for the trials.
Okay.
Once he approves the trial, then we call him for final bonding.
Wow. So typically somebody who comes in from the United States or from the United Kingdom
Yeah.
and they want, because a lot of people, the dental costs are phenomenal there. So I know a lot of people who come down, they fly down, they get their teeth done and they go back. So let's say if somebody were to land on a Sunday and visit you for the first time on a Sunday, what, by the following Sunday he's done?
Yeah, definitely.
Wow. So in about a week to max 10 days, the entire process is complete.
We can do that.
And when he goes back, is there any form of kind of upkeep that is required?
No, just that he has to, like, obviously, veneers, they are the artificial, but all
Correct.
present on the front surface.
But that can he then bite into apples and stuff?
Yeah, but he can, but
Right.
he can't directly bite on the hard objects.
Okay. So avoid chicken bones and stuff like that, right? Yeah, okay. Great. But I mean, biting into fruit and
Yeah,
stuff
and
is absolutely
nowadays veneers are so modernized that even they are stain free.
fine. Right.
Initially, there were veneers which used to get stained.
Right. So for heavy smokers, for example.
Smokers, coffee lovers.
Oh.
So nowadays, the modernized veneers, they are stain free.
Right.
So they don't get stained easily. And
So effectively, what you're saying is a chain smoker, he can get his teeth colored and say that he's absolutely fine. Whereas his lung report may prove otherwise. Wonderful. It's all very nice when you talk about a beautiful smile. What about the pain involved?
it's a painless procedure.
Oh wow!
And it's
Wow.
done the second step, which
Maybe you should repeat that a little louder for most people.
yeah,
It's painless.
It is a painless procedure.
Fantastic. No, I'm sure that will draw a lot more people to come to you.
Like I said,
Right.
everything depends on how anxious the patient is.
Mhm.
He might notice or he might feel a slight sensitivity.
Correct.
But while the second step, which I said, the tooth preparation,
Right.
when we grind the frontal surface or the enamel of the tooth.
Correct.
So, and there are veneers nowadays which require minimal grinding, and sometimes if the teeth if the patient's concern is to get bigger size teeth,
Right.
then we can completely skip that step
Wow.
of grinding.
Wow. Okay.
Yeah.
Okay.
Grinding is just like we are creating the space for the veneers
So
to
even
fit.
after the teeth are ground.
While grinding, we do it under local anesthetic.
So my question, Doc, is is your second step, which is the teeth grinding. I mean, grinding itself sounds painful.
Yeah.
So, how does a patient manage once he gets home?
See, once he's done with this second appointment, that is the
Right.
tooth preparation
Correct.
step, we give them him a temporary.
Mhm.
It's we do make it from a cement only, tooth
Right.
colored cement.
Right.
Yeah, which we give him temporaries, which we put it on the same appointment, and then he can leave with the temporaries. Temporaries are similar to the veneers only,
Okay.
because he can't go with pegged shaped teeth.
He can't,
Yeah.
obviously. Yes.
So we give him temporaries, and then we send him, and after 3 days he comes for the trial.
No, this is marvelous because I know, for example, when one goes for a hair transplant, the fear is not so much the procedure, which takes a day, but how would I then look with a bald head? So your thing is very comforting because
Yeah,
you see
it's
even after your
comforting.
teeth are ground, you don't have to hide your mouth or wear a mask, right?
Yeah,
So you can
so
go
that's what
this
I
is
said.
marvelous. I mean,
Yeah, so that's what I said, because smile is your first aesthetic.
yeah, it is your first aesthetic. It is actually the first thing people notice. So if
So even in the procedure, we give temporaries, so that patient won't feel discomfort while talking.
so
or
there is
working.
never a need then to wear a mask during the entire procedure to hide your.
No,
Wow.
not at all.
Wow.
If few patients are not comfortable with the grinding,
Right.
so it depends on them. But
Correct.
mostly we try to give them temporaries.
Correct. Fantastic. No, fantastic. No, I was just trying to figure out that, if the process involved after effects, as in, pain or discoloration or something that required you to cover your mouth, then obviously you need a week off. But in your case, this is really heartening to know. Yeah. Now, you must have had various cases that you dealt with. Any case that comes to mind for whatever reason that was outstanding, that the patient had outstanding results, or conversely where things didn't go according to plan? Anything that comes to your mind?
Yeah. So see, I had a patient.
Right.
He was getting married in like a month or something.
From
Yeah.
the time he came to see you.
Yeah. So, but he had this rotated tooth, like the front two incisors, they were overlapped a bit.
Oh.
Yeah. But he did not wish for any more preparation.
Right.
He just he wanted veneers.
Right.
Yeah. But there was a tooth which has to be restored, and he had to get a root canal done. And then we gave a crown on that tooth.
Oh, I see.
So there was in the whole arch of all the upper teeth, one tooth was given crown, and the others were veneers. So we designed it accordingly. And he's not even from Pune, so he used to travel 8 hours
to come to you.
Yeah.
Wow.
Yeah. So it was done in 7 days only.
Right. I'm sure his wife wouldn't have the similar kind of patience. But after that, what did he find? I mean, obviously he must have looked fairly even more attractive to his wife. But what were the statements to you post this treatment?
He was very happy with the treatment of this. So now, like, I think it was my initial phase of my clinic.
I see.
Of my like what we say career.
Correct.
He was the first patient of mine for the veneers.
Oh, I see. Wow. So it's always very special.
And that too a very complicated case.
Correct.
Because there were not just veneers.
Right.
It also included crown. So he was quite happy, and he's still my patient. Like he refers everyone.
Doc, we know of aligners and we know of veneers.
Yeah.
How do you decide which one goes where?
So aligners, like we say nowadays, Invisaligners are very trending. So this comes under orthodontic treatment.
Right.
So
and I think obviously it takes a much longer period of time.
Yeah, and veneers mostly they comes under smile designing.
Right.
So difference is that veneers they take around 7 to 10 days, as I mentioned.
Right.
It's a quick treatment.
Correct.
Yeah, if the people want to get their teeth replaced and designed in lesser time.
Right.
So they can go for veneers. Right. And aligners, they take few months to years. So that's the difference. And the major difference is that veneers can just replace the teeth color, shape, or symmetry, or if there's any chipped off tooth present, or there are few minor spacing in between your teeth.
Correct.
But they can't replace the rotated teeth, the alignment of the whole arch, the way the person smiles.
Correct.
Yeah, so they can't replace it. Mainly, they can't replace the alignment or the repositioned tooth.
Oh, yes.
So few people, they have tilted, forwardly placed.
So you have to necessarily get them aligned first before the veneers are installed.
And few people, they have bite correction, like the bite
So what do you mean by bite correction?
correction,
Where the upper and lower jaw are aligned?
overlapping of the upper and lower jaw.
Oh,
So this we have to check before. So few people, if they have deep bites,
right.
like the incisors are going completely
Oh, yes.
inside, we can't give them veneers. Then
Right.
then there are chances of breaking off.
Okay. Look, I've also heard this term. Like you normally talk of teeth alignment, but is your jaw also sometimes not aligned?
So in few patients, there are forwardly placed jaw, forwardly placed maxilla.
Right.
So in these cases,
There are people I've seen with kind of a protruding lower jaw.
protruding lower jaw,
Right.
protruding chin.
Right.
So in these cases, if we cannot replace them with braces
Right.
or aligners,
Mhm.
they opt for orthognathic surgeries
And
like
what is that?
genioplasty, etc.
Mhm.
So in that, it's a surgical treatment.
Where the alignment happens, is it?
Yeah. In that, we just cut
The bone.
bone and we place it forward.
Right.
Or sometimes, if especially in the chin,
Right.
if it's placed forwardly
Right.
or it's placed backward, then we can just push it ahead. It's a surgical procedure.
You hear all these horror stories today with fillers. People who go to get their kind of
No,
cheek.
and also, in smile designing, we also include fillers.
Oh, I see. Oh.
Fillers and Botox.
Oh, I see. So what do you mean by include?
See, so smile designing also includes gummy smile correction.
Yeah.
So there are few patients who have gummy smile. Gums are more visible while smiling.
Mhm.
So in that case, sometimes what happens, their muscle, the
Right.
upper muscle, the lip muscle around the lips,
Right.
they are more active. So there's presence of gummy smile.
Right.
So what we do is we insert Botox
Mhm.
in the upper lips.
Mhm.
So the muscle over there, it relaxes and it covers or it hides that gummy smile.
I see. Okay.
It's because of the hyperactive muscle in few cases.
I see.
Depends.
Wonderful.
And if the gums are all, presence of gums is more
Mhm.
and visible, so we can combine Botox with gingival contouring.
Which is what?
So what happens? Gingiva is like the gums which
Right.
covers the neck of the teeth.
Mhm.
So what we do is the procedure is called Gingivectomy. So we can do it with scalpel or nowadays laser, because obviously patients are scared with blades.
Absolutely.
So with lasers, we just take out a small portion of gingiva around the neck of your teeth,
Mhm.
so that your gums are less visible.
Okay.
Yeah.
Okay. So, Doc, now you have the perfect smile.
Yeah.
Which you need to showcase at some place. What are your other interests?
Other interests, like I love hanging out with my friends.
Okay.
I have a huge friend circle.
Right. Do all of them have beautiful smiles?
Yeah. At least I try to advise them.
Correct.
If not,
correct.
then come to me.
No, but so you love to travel. You
Yeah, I love
to-
traveling. I
Okay.
love hanging out with my friends.
And exploring new eateries and hangouts.
And also hanging out with my son.
Oh, and how old is he?
He's 3 years old.
And what's his name?
Krishna.
Krishna. Okay. So obviously he's a major part of your smile.
Yeah,
right?
yeah.
He's
True,
he's the one guy that enhances your smile. Wow.
But I think currently now my smile depends on him.
Very, very aptly put. But Doc, very rarely have I come across a dentist who's as pretty as you. Have you ever thought about getting into the world of pageantry?
Yeah, like initially,
Right.
now also many of my friends and
Tell you
cousins,
to,
yeah,
yes,
they keep telling me that
Right.
why don't you try?
Correct. No, and I'll tell you another thing. Added to your looks is your height, which is a kind of prerequisite, because at least especially for modeling, the 5'6", 5'7" is what is kind of mandatory for any international.
Mine is 5'7".
Which is fantastic. I mean, I notice you normally walk around in flats because you don't have too many guys who are taller than you. But Doc, on this, since this is our profession, the smile is something that, like somebody very beautifully told me, a smile is a curve that sets everything straight. So being this enhancement or this visual enhancement, what is your advice specifically to people entering in the world of pageant?
See, like you said, like smile is the first thing which is noticed.
Correct.
And we in pageantry, we obviously need a stage ready smile.
Yes.
Because it shows your personality.
Correct.
How you're expressing
It's the one case that showcases you even before you speak.
Obviously.
Right.
The way you speak also matters.
Yes,
And the way you speak is expressed by your smile.
it is. It is.
So
Your confidence level.
yeah,
for that.
it adds a confidence and an enhancement.
Doc, when a man senses he's balding, he normally goes for a fitted hairpiece. Sadly, in many cases, it looks very fake. Is this also the case with veneers?
True. See, we can't give like sharp edge veneers
Right.
or bigger size veneers, bigger looking teeth for old age person.
Correct.
So veneers also we
It varies according to the age
it
of the
varies
person.
according to the personality,
Right.
age, face of the person.
So you mean a younger person would get a different set of veneers?
Yeah. So usually what happens, younger, bold-looking person. So obviously bold-looking personality.
Correct.
It varies according to the personalities. Also.
Right.
So younger, bold-looking personalities, they have veneers with sharper incisal edges, and they are more translucent.
Right.
Yeah. So and layered. We use layered ceramics in that.
Correct.
So the appearance there, it's more translucent and sharp.
Right.
In older patients, old-aged patients, they have veneers with more opacity and soft incisal edges we give them for the natural appearance according to their age.
Oh, I see.
Yeah.
Doc, dentistry is an ever-evolving field that requires constant upgradation. Do you frequently travel overseas to enhance your skills?
Yeah, that's true. Like not just from my graduation days, like till now, we keep having conferences twice a year, thrice a year. There are conferences happening every month in every city regarding what new
which requires an upgradation.
There are
of
studies
skills.
happening every time. There are new studies happening. People are more focusing on what's new, what's trending, what's beneficial for the patient more.
Correct.
Mainly according to the pain, according to the costing, according to the customization and sustainability.
Right.
So every time there's new material coming up, new treatment coming up. So we have to stay upgraded.
Fantastic. Yeah. So your teeth only don't just need upgradation. Dentists require it too.
True. And also nowadays there are many AI generated softwares, AI generated machines, which makes our work and also the patient's work very easy.
So Doc, here's a trick question. Do veneers help you to glow?
Yeah, of course. Veneers are the only treatment which can be done instantly with minimal efforts and maximum glow.
Wow. Maximum glow, and that's the one thing that really shows.
Yes, it's like a VIP upgrade to your smile.
Doc, in this wonderful journey, any special achievement or maybe papers you might have published?
Yes, of course. Like I have done 3 studies which are published online and also a book on wound healing.
Wound healing?
Yeah. So we, in our post-graduation, we have to do a book for ourselves.
Right.
Which is published. You can see it on Amazon.
I see.
Yeah, the topic is wound healing and have done 3 studies. One is regarding PRP, which is the most trending treatment right now. People are using it also in cosmetology now for vampire facials, for loss of hair volume. So I've done a study on PRP. Then there are studies done in diabetic patients where I do I check their gum health. Accordingly, I give them treatment using aloe vera gel.
Okay. And does it help in the case of diabetes?
Yes. They help in the case when there's gum recessions. You can see the gum recedes.
The teeth get more prominent.
Teeth get more prominent and they get more mobile. So in that case, I have done a study where I used this aloe vera gel and have injected it in the pockets of the gums of the diabetic patients.
Oh, I see.
Yeah, then there's one more study which I have done. It's a short study, which is done on the instruments, on the periodontal instruments which we use to check the gums. So these are the 3 studies which are published currently online and a book.
So Doc, my question is, before we come to the end of this fascinating session, any words of wisdom you'd like to leave us with?
Yeah, I would like to say that smile designing is about custom creating the beautiful version of your smile depending on your face, personality and age. And also I would like to mention that celebs, they just don't have good genes. They have good dentists.
Celebs don't just have good genes. They've got great dentists and none better than Dr. Aishwarya Navale from the Crown Aesthetic.
Thank you.
Doc, I think it's been absolutely fascinating, this session with you. And may more people, I know your clinic is at Koregaon Park, right?
Yeah, it's in Koregaon Park, Lane 6.
Lane 6. and it's above story 6.
Stories, yeah, just right above stories.
Right above story 6. So when you step above story 6, you will change the way your story unfolds.
It's one more punchline.
Yes. So absolutely marvelous, speaking with you and interacting with you, Doc. And more power to you. And may the Crown Aesthetic share and spread more smiles nationally.
Thank you so much, and thank you, really, thank you for having me here.
You're most welcome. Absolute pleasure.